here we're going to do with Theories and Therapies Part 2. So let's begin with Harry Stack Sullivan's interpersonal theory. So Sullivan, growing up, did not have a good relationship with his father. So all of his theory was based on development of interpersonal relationship and its influence on personality and how, if these interpersonal relationships are not met, how it can cause anxiety. So he said all of a behavior is to reduce or avoid anxiety, and through interpersonal interactions we can reduce them. So he defined anxiety as any painful feeling or emotion that arises from social insecurity. And some measures that we use to reduce this anxiety and to enhance security is called security operations. And he said all of the personality traits and all of these security operations an individual uses to defend against anxiety and to ensure self-esteem is called self-system. So Sullivan said all of the personality traits that a person possesses is the self-system. And it is not merely from unresolved conflicts, or it is not merely from stages of sexual development. He said there is an interpersonal relationship that needs to be built. Our theory of nursing by Hildegard Peplow is based on the interpersonal theory by Sullivan. So the main goal of interpersonal theory or interpersonal therapy is to eliminate psychiatric symptoms by improving the interpersonal functioning and their satisfaction with social relationships. For example, in case of depressions, a patient is not able to make that intimate relationship or not able to communicate with the family or communicate with their peers. So developing that social relationships can help that individual to reduce their anxiety and can improve their personality or can take off their stressors. So that is what interpersonal therapy or interpersonal psychotherapy said. It is most effective in treating grief, role disputes where there is conflict with a significant other, role transition when a person changes their social or vocational role, or life status, maybe a divorce or maybe separation. Then interpersonal deficit where a person is not able to maintain close relationship with another person. So these are some effective cope method that can be used, and it is proven to be very effective for depression. Our psychiatric mental health nursing has a basis on interpersonal therapy. We use a lot of them, like developing relationships, having a positive environment or an accepting environment, empathy towards patient. All of this comes from interpersonal therapy. A promoting of a psychotherapeutic environment in the hospital setting or in a residential or a day hospital setting is based on interpersonal therapy. A nurse has to use principles of respect, mutuality, unconditional acceptance, empathy. All is important aspects of Sullivan's theory of interpersonal therapy. So Sullivan's theory formed the basis for Hildegard Peplow's theory of interpersonal relationship. So he coined the term participant observer. So a nurse or a therapist is not just a mere or a passive observer. He is an active participant in forming the relationship or helping the patient. There is a mutuality, respect for the patient, unconditional acceptance, empathy towards the patient. So Hildegard Peplow, she developed the first systematic theoretical framework for psychiatric nursing in her book, Interpersonal Relations in Nursing. She was the first to identify that the nurse-patient relationship is the foundation of nursing practice. She tried to change the focus of nursing from doing to the patient to be with the patient. She shifted the model of focus from medical treatment to interpersonal relational model of nursing practice. She also developed the stages of interpersonal relationship or the nurse-patient relationship. So we already saw that as orientation phase, working phase, and the termination phase. She also used the technique of process recording. It will help us to develop, or the students to understand, what techniques that we're using, what may be therapeutic, what may be non-therapeutic. We are looking at the communication and our non-communication skills like active listening. Are they looking down? So being completely self-aware of what nurses do or what patients are doing to explain the behavior. So she mentioned that there is both art and science of nursing. In art of nursing, we use the skills of caring, compassion, and advocacy. And use of science, a nurse uses her knowledge and skills, psychosocial interventions to help the patient's suffering and to promote growth. So Sullivan said the skills of a psychiatric nurse include observation, interpretation, and intervention. The nurse observes and listens to the patient and develops impressions about the meaning of the patient's situation. And by employing this process, the nurse is able to view the patient as a unique individual. So mentioned earlier, the art and the science of nursing. We use our skills, our caring, our compassionate nature, our respect for the patient, our mutuality, which enhances comfort and well-being. And then we use the science of nursing, our knowledge, our skills, our knowledge about the evidence-based practice. Our critical thinking is used here. Peplow further mentioned that there are levels of anxiety: mild, moderate, severe, and panic. And depending on the stage of or the level of anxiety a patient is in, our interventions should be directed to reduce the level of anxiety. Our therapeutic relationship must be built to improve the patient's ability to think and function in whichever level of anxiety they are in.
According to Freud, a person's personality was set in stone by early age, but other theorists said that's not the case. Behaviorists believe that behavior can be influenced through a process called as conditioning. Conditioning involves pairing a behavior with a condition that reinforces or diminishes the behavior's occurrence. So the behavior said our personality is dependent on learned behaviors throughout the life, the ones we learn and reinforce. So the major behavior theories include Pavlov's classical conditioning theory, Watson's behaviorism theory, Skinner's operant conditioning theory. So in implications for nursing, it is helpful for modifying or replacing behaviors and also helpful for behavior management of certain behaviors. So let's look at what is classic conditioning theory. Let's look at classical conditioning by Ivan Pavlov. Ivan Pavlov was a Russian physiologist who studied about physiology of digestion. So he won a Nobel Prize for that too. So once he was observing the dogs, he found that the dogs were able to anticipate the food and started salivating. So he did more experiments or did further observation on the dogs. So he learned that before conditioning, food, the unconditioned stimulus, is called the unconditioned stimulus. When the food is provided, the dog salivate. That is the unconditioned response that is normally expected. So then he did a bell. That is a neutral stimulus. So when he rang the bell, the response would be no salivation because the dog has not associated the bell with the food. Okay? So during conditioning, he associated food with the bell. He put food and then the bell. So the dog began to associate, okay, when you rang the bell, you brought the food, so that means my food is almost ready. It was the unconditioned response again. He salivated. So after that, just ringing the bell, the dog started salivating. So that is the conditioned response. The conditioned stimulus was the bell, and now it provided a salivation, that is the conditioned response. That is, a neutral stimulus can produce salivation. So according to this classical conditioning, an example of human behavior is that if a person gets ill by eating something at a fair, and then after that the smell of the same thing can produce nausea, so that is an involuntary response by a person. That is the classical conditioning. So a behavior, he was going to picnic, he was eating the same food for many years, but no issues. But once he was eating the certain food and has had a worse nausea, vomiting, all the associated symptoms, the next time he smelled that or make an association that no, this is not good for me, so will have nausea. That is because that's the involuntary response learned through classical conditioning. Another behavioral theory is operant conditioning by B.F. Skinner. So he did experiments on rats, and according to B.F. Skinner, operant conditioning is a method of learning that occurs through rewards or punishment for voluntary behaviors. So first experiment was that he put the rat in a box called Skinner box. The grid was not electrified, and the rat touches the lever and the food was dispensed. So the rat learned that, okay, whenever I touch the liver, I get the food. That's a positive reinforcement. So whenever you do a behavior, you get a token. So that is a positive reinforcement. Whereas the next time he did the experiment, he made the grid electrified. So there was shock delivered to the rat. So by accidentally, when he touched the lever, he understood that the shock would go off. So whenever there was shock, he would go touch the liver and the shock was not there anymore. So the rat learned that, okay, this negative stimulus or aversive stimulus of shock can be controlled by touching the liver, or doing that particular behavior would reduce the aversive stimulus. So the rat learned that. So that is called the negative reinforcement. And next technique that which is by operant conditioning is punishment. For example, if you get a speeding ticket, and for a mature person, you tend to reduce that behavior. And next is extinction. That is, absence of reinforcement will reduce the behavior. For example, when a teacher has a child who is acting out in the class, initially he would reward, she was like, okay, please don't do the behavior again and again, and then it is kind of reinforcing the behavior. So when the child act out, if you ignore, the behavior can reduce. So that is called extinction. Another famous behavioral theorist was John B. Watson. So Watson believed that a person's personality traits are socially learned through classical conditioning. So he said that controlling the environment could change the behavior of a person. So he did a terrible experiment on a child who loved animals. So little Albert was having a good time with his animals. So what Watson did was he introduced a white rat in the same room of little Albert, and when the child would reach for the white rat, he made a big noise um, using a hammer. So the child started associating the loud noise with the rat. So whenever Albert would see a white fur or hair, even in the absence of the noise, he was startled and he had a terrified response. So that was Watson's study, and Watson understood that, okay, even if the loud noise was not there, he became terrified. So he said that a person's behavior can be changed by controlling the environment.
So coming on to behavioral therapy. So from the behavioral theorist, the main assumption was that a maladaptive behavior can be changed without looking into the underlying cause through various techniques. So one technique is modeling. Modeling is where the therapist acts as a role model for the patient. Also, patient can role model situations which had brought about this maladaptive behavior in the past, but they are trying to do what could be adaptive behaviors in the similar situation. They role model them and practice it so that it becomes the automatic response when the similar situation arises in the future. For example, one person gets angry at his wife when the wife says something, and then at a similar situation, what he could have done differently is what therapist asks or him to look into. So he trains that, he practices what he could have done differently in the similar situation without showing a maladaptive behavior. Instead of throwing away, so he could have just walked away or taken a walk, and so maybe you take a break for 5 minutes and come back and talk again, so that you're not emotionally charged when you act a behavior. Next is operant conditioning. Operant conditioning is where positive reinforcement or negative reinforcement is used so that that behavior does not stop or continue. Next is systematic desensitization. Systematic desensitization is used in case of fears, where the patient is asked to list the fears in a hierarchical form. So the first one is the least fearful situation, and then going down there are situations that the patient most fearful of. So from the first fearful situation, even before looking at the fearful situation, the patient is asked to practice progressive muscle relaxation and learns to identify if he is fearful and how that fear can cause parasympathetic or sympathetic nervous system activation and cause this fear and anxiety, and the patient is able to learn these relaxation techniques so that it calms down. So again, after learning the progressive muscle relaxation, the patient is asked to look at his least fearful situation. And then again, in that situation, progressive muscle relaxation is practiced so that it becomes a routine. And then slowly, the person progresses to the most fearful situation. It can be used in case of fear of flying or fear of heights. So where he can, for fear of flying, they will be given a simulation, like initially videos of visual presentation of flying is shown, and then with videos, and then the patient may be taken into a busy airport, or the patient can slowly learn to tackle the situation by means of relaxation techniques. Next technique is aversion therapy. Aversion therapy is used when you give punishment or some kind of aversive stimulus. For example, there's a drug called disulfiram or antabuse for alcohol dependence patients. So, but again, it was we have to check that if the patient's rights are violated, and is it in the best interest of society, or is this therapy in the best interest of the patient? Because here we are giving an aversive stimulus to the patient. For if you give this drug and the patient had taken alcohol, patient would vomit and have a severe discomfort, and patient can have sometimes very aversive stimulus, like patient may not be comfortable at all, nausea, vomiting, diarrhea, which causes this aversion towards alcohol. So he tries to not drink alcohol the next time. So next is biofeedback. Biofeedback also, it can also be used in response to control stress and anxiety. So patient is able to identify his increase in heart rate or increase in blood pressure by means of some mechanisms. For example, you have a watch or something which monitors your blood pressure or your heart rate. You understand that, okay, you are going, my heart rate is raising, and I should try to relax at this situation. So these techniques are commonly used in nursing. For example, token economies are used, and even in behaviors such as smoking, overeating, alcohol, or substance use problems, this behavioral model can be utilized. Personally, I use this technique of token economy with my child because he wanted to watch television during the weekdays, but then his behavior would, if I turn it off, then the behavior is like he would just show tantrums and stuff. So we made a pact, like, okay, we will not watch television during the weekdays. We will watch television only on the weekends for 2 hours. So if we don't watch televisions during the weekdays, we'll get some toy, or he does not get a toy. He gets crayons or coloring books. That's what he likes most. So we get something like that. I'll take him to the shop and get something in the weekend. So it reinforces that, okay, if he does not do this behavior, he gets a token. So that's how I do the behavioral theory application.